this is Dr. Rishi Gupta. I'm an associate professor of ophthalmology at Dalhousie University in Halifax, Nova Scotia. Eye basics. The eye is like a camera. There's a lens in the front of the eye, and we call that a cataract if it has clouded over from aging changes. Light gets focused on the back of the eye, and the tissue that lines the back of the eye is called the retina. The center of everyone's eye is filled with a jelly fluid called vitreous. What is a macular hole? The most important part of the retina is a tiny divot right here. That's called the macula. Although it measures only millimeters, that's what we use to read and see people's faces. The rest of the retina gives us our side vision or our peripheral vision, but it's this very center part, the macula, that allows us to see details. Some people can get a hole, unfortunately, right in the macula. This is a high magnification picture, or OCT, of a normal macula. The bottom picture is of a patient with a macular hole. You can imagine that because of this change, a person's vision might be missing a spot in the center, or be blurry, crooked, or distorted. What causes a macular hole? The center of everyone's eye is filled with a clear jelly fluid called vitreous. As we have more birthdays, that jelly fluid will peel away from the retina. That's a normal aging process in almost everybody. However, in some people, that jelly fluid stays stuck down around the macula and can pull open a hole. Can surgery fix the hole? With surgery, there is on average about an 85% chance that the hole can be closed. What happens if I just leave it? If you don't do anything, the hole will most likely get bigger with time. In that case, it will become more difficult to read and see people's faces. Because it's only affecting the very center of your vision, you would never go blackout blind because of this. However, one could go quote-unquote legally blind, where, for example, it might be hard to see the large E on the vision chart at your doctor's office. If the hole closes, will my vision be normal again? The first goal of surgery is to get the hole closed. This should stop your vision from getting worse over time because of the hole. If the hole closes with surgery, typically the vision is not perfectly normal again. There is damage done from the hole that we cannot get back. However, many people will regain quite functional vision with slow improvements over 6 to 12 months following surgery. If the hole closes and my vision is still blurry, would glasses help? Glasses may be able to help to a certain degree. However, there's a part of the vision that glasses cannot fix. Again, there is damage done from the hole that we cannot always get back. You should wait about 6 weeks after surgery before meeting with your glasses doctor to see if glasses may sharpen up the vision. Tell me about the surgery. The surgery to fix the hole is called a vitrectomy surgery. It is a day surgery, meaning you do not have to stay in hospital overnight. We remove the jelly fluid vitreous that fills the eye, and we peel some membranes around the hole to help close the hole. At the end of surgery, your eye will be filled with a gas bubble. If you have not had cataract surgery previously, often this is done at the same time. Tell me about the gas bubble. The gas bubble can be very annoying. While it's there, the vision is very blurry, like being underwater. You may notice a dark line, and then perhaps a dark circle down below in your vision that gets smaller and smaller and disappears as the gas goes away on its own. Depending on which type of gas is used, the gas may be there for a few weeks or even a few months. While you have gas in the eye, there are several rules. You cannot travel in an airplane or drive to high altitudes. You should avoid jarring or jumping movements. Minimize driving. You should not lay on your back, and for the first week, face-down positioning is important. You may take 10-minute breaks, and you may sleep on your side. Is there anything that can help with face-down positioning? There are companies that rent appliances to help with face-down positioning. Our staff can help provide you with that information. Do I get a general anesthesia? We know that the thought of having eye surgery makes most people anxious. So we have another doctor in the room, an anesthesiologist, who is there to give you medications to keep you calm and comfortable through an IV. So while you will not have a general anesthesia, it's not uncommon for patients to fall asleep during surgery because of the medications that you are given. And of course your eye will be frozen, so you should not feel any pain. What do I need to do after the surgery? After the surgery, it is important to keep the eye clean. Do not rub the eye or bump it. Make sure that you take your drops. You can use Advil or Tylenol for pain, and follow the rules for gas in the eye. After the surgery is done, our nurses will go over all your instructions with you. What is the recovery after surgery? Usually there is not too much in the way of pain. It is normal for the eye to feel scratchy or like there is a grain of sand in the eye. Day by day it gets better, and Advil or Tylenol should do the trick if needed. You will have drops to take, and we ask that you take it easy from activities for a few weeks. What are the chances surgery makes me worse than if I just left the hole? The chance that surgery makes you worse than if you just left the hole is about 1%. That would be if you had an uncommon complication such as a retinal detachment, an infection in the eye, or a bad bleed in the wall of the eye. Is a macular hole the same thing as macular degeneration? A macular hole and a condition called macular degeneration are very different things, but both happen in the same place, the area called the macula. What are the chances it happens in the other eye? About 5 to 10% of people will develop a hole in one eye and later get a hole in the other eye. Unfortunately, there is nothing we know to prevent this. So I hope you found this video helpful, and thank you very much for your time.